Ernie, Scott, Michael. What do those names mean to you? Absolutely nothing. But what do they mean to me? Is everything. These men in my family who suffer from PTSD, from 2 tours in Vietnam, the front line in Desert Storm, and a deployment to Eastern Europe. Research in the treatment of post-traumatic stress disorder is now being done using psychedelic-assisted psychotherapy, specifically psilocybin, ketamine, and MDMA. Suicidal thoughts, flashbacks, depression, anger, nightmares, post-traumatic stress disorder, psychedelic-assisted psychotherapy. What do they have to do with each other? And how can psychedelic-assisted psychotherapy change how people with PTSD are treated and possibly cure of the nightmares, suicidal thoughts, and anger they face? Psychedelic-assisted psychotherapy clinical studies consist of administering mind-altering drugs, psilocybin, a naturally occurring psychedelic prodrug compound produced by more than 200 species of mushrooms, ketamine, a compound used for starting and maintaining anesthesia that introduces a trance-like state while providing pain relief, sedation, and memory loss, or MDMA, an abbreviation for methylene dioxymethylamphetamine, also known as ecstasy or Molly on the streets. Psilocybin, indole alchemy, or magic mushrooms, is a type of hallucinogen and has only been tested in small trials of less than 50 people, and more trials are needed. Many experts believe that it may not be long before psilocybin is legally available one way or another in various parts of the globe. Progress is moving forward, and at least in terms of decriminalization. Denver voted in May to become the first city to decriminalize psilocybin. Ketamine. No good current strategies are available for these non-responders. People don't respond to traditional prescription medication, so novel agents are being studied, including ketamine, which is accumulating an evidence base as being rapidly effective for an array of anxiety disorders, including social anxiety and PTSD, said Prakash Masan, MD, co-founder and chairman and CEO of Centers of Psychiatric Excellence, or COPE. Dr. Jennifer Dorr, a psychiatrist, article, Ketamine-Assisted Psychotherapy, Patient Demographics, Clinical Data, and Outcomes in 3 large practices administering ketamine with psychotherapy shows that while ketamine-assisted psychotherapy is a new and unique method for treating PTSD and other psychiatric diagnoses, it significantly diminishes depression, anxiety, and PTSD, and increases the well-being for those who are treated with ketamine. In an article published in Lancet Psychiatry, Michael Mitherford, MD, states that PTSD is relatively common condition in military personnel returning from active duty and is difficult to treat. Dr. Mitherford, a psychiatrist specializing in treatment of post-traumatic stress disorder, PTSD, researched the use of MDMA, ecstasy, and found that when combined with psychotherapy in a controlled setting, MDMA was effective in reducing symptoms of chronic post-traumatic stress disorder in small studies of military personnel and emergency first responders. In its Phase 2 trial, together with other Phase 2 trial, has led the FDA to designate MDMA-assisted psychotherapy as a breakthrough therapy, potentially hastening its approval as a treatment. His most recent study, Phase 3 trial, are the most powerful evidence yet that MDMA-assisted psychotherapy could help transform the lives of people suffering from PTSD. Dr. John Crystal, who heads Neurosciences Division at the Department of Veteran Affairs National Center for PTSD, describes the current lack of effective therapy as a crisis. The problem is that we don't have many treatments, and what we have doesn't work that well, he said. Only about 1 in 3 combat veterans with PTSD are effectively treated, often using a combination of off-label drugs. Doctors tried to manage patients' nightmares, flashbacks, and depression, but the drugs do nothing to treat the underlying conditions and can have negative effects. The FDA is set to approve MDMA-assisted psychotherapy for PTSD by 2022. The Multidisciplinary Association for Psychedelic Studies, or MAPS, believes such treatment will become widely available for the following year. While more research and trials need to be done, these psychedelic-turned medical drugs administered under medical supervision show promise for people struggling with depression or PTSD, for whom standard drug treatment hasn't provided relief. If further studies confirm their benefits and safety, they could one day become the standard part of treatment for these and possibly other mental conditions. Psychedelic-assisted psychotherapy may be the future for treatment of PTSD. It may be too late for soldiers who served in Vietnam, but perhaps those who serve or are currently serving in war zones, it may be the cure.